Thanks again for staying around for the benefits discussion. You know, we have, I really can't count how many Affordable Care Act presentations we have given as a group and as a benefits team. And, you know, we started this year, I felt like, at least, I've said this several times in presentations, that I felt like we started this year with a fairly quiet year, and it was kind of nice that we caught our breath. And then the month of February rolled around, and we had final player pay regulations. We had final regulations on the 90-day waiting period rules. We had employer reporting rules that come down the pike. We've had new same-sex marriage guidance, and we expect more coming. So what started out as a fairly quiet beginning to our year has resulted, or you know, we've kind of ended up, at least as of April, with a lot of new stuff. And my partners, Jim Prince and John Papahronis, are going to kind of walk us through the latest ACA developments and things that you guys should be thinking about right now. And I told them just now, kind of nudged them, and I said, I'm here to learn. I'm going to ask a lot of very hard questions. So they're going to do great.
Is my mic working? Okay. Are you going to do go ahead. So we start out here with the, yeah. Well, it's going to get better. It's going to get better. So it really is, we're talking about healthcare reform.
Just get it over with.
So here's what, I mean, this is sort of, you know, healthcare reform was passed 4 years ago, and this is what time can do to you. I don't know how to, okay, I mean, that was pre-healthcare reform. Here's shortly before healthcare reform. Another one, healthcare reform, and now. And you know, you may be thinking or saying to yourself, amusing, but what does that have to do with healthcare reform? And actually, probably a number of people are thinking, what was he thinking with that mustache, right? But there is a couple of points here that we're trying to make, and we've done it in a number of ways. Some of it is self-humiliating, but the first one is, it's here, you know, and time, it's been around. It doesn't look like it's going away. So we need to make sure that we're ready for it, because there are a number of significant penalties that attach if you don't comply, and some of which can happen inadvertently. So part of our message here is to begin with, we are looking at trying to comply with the law, not hoping that it's going to go away. And the second thing, probably almost as important, is that this is what you get. I mean, you have it is here, it's staying, and we've got to comply with it. So don't let it sneak up on you. Don't let what you were doing 5 years ago, which sounded like a great idea then, necessarily make you believe that it's a good idea now. Same way that, like I said, that mustache seemed like a good idea at the time, okay? So with that, let me just introduce what we're going to talk about primarily is compliance with the shared responsibility, the employer responsibility, or often called the player pay requirement, which is the requirement that's imposed on employers, large employers, and those are the employers who have at least 50 full-time employees or full-time equivalents. So if you're clear that you don't have 50 full-time employees counting full-time equivalents, you can kind of turn off about 2/3 of this presentation. We're going to talk some of the basics. John's going to talk in somewhat detail about some of the significant issues involved in the determinations that have to be made for the shared responsibility. But I want to just, reiterate, it applies to large employers and it applies to full-time employees. And full-time employees are people who work 30 hours or more per week on an average. So what we're not really going to get into the details on are how, if you have employees who are, quote, variable hour employees, those are the employees who, when you hire them, you don't know how many hours a week they're going to work, and you are permitted to then use a measurement period of up to 12 months to make the determination as to whether they're full-time. We're not going to get into the details on that, on the application of the measurement period, or how that specifically applies. That was covered. We covered that, actually. Brandon and John, at the end of the materials on this section is a link or a reference to a webinar that we did 6 weeks ago that delved into application of the concept of using a measurement period to identify who your full-time employees are. So today we're going to talk about some more specifics in terms of how you count hours and what employees have to be included. And with that, I will pass the baton to Mr. Papahronis here.
Okay. What we're going to, and again, like Jim said, what we're going to be doing is kind of giving an overview and trying to tie together a lot of these concepts that apply to the player pay rules. We did the specifics earlier, so this is a little bit more of a higher level overview and kind of pulling together. And the first aspect of player pay, there's the A penalty, or what we call the no coverage penalty. And that's generally an employer has to offer minimum essential coverage to all but 5% of their full-time employees in order to avoid this penalty, the no coverage penalty. And so when you look at that, the rule consists of, as it says on the slide, one of the important things is an offer. The employer has to offer the coverage to its full-time employees. And that's considered to be, if you have an evergreen election, that's considered to be an offer. If you have collectively bargained employees and you're bargaining with the union and the union turns down your medical plan, the final regulations have said that doesn't constitute an offer, believe it or not. So even if the union turns down your medical plan and chooses to do whatever they want by themselves, the employer is still on the hook for offering coverage. Otherwise, you haven't fulfilled that requirement. Now, when the current rule is 95%, and I'll talk about in a minute that there's a transition rule. But if you've not offered to 5.00001% of your employees, you missed the level, and it triggers this entire penalty. So it's really, really important, as you can see, to accurately identify who your employees are, because if we're talking about you've got a 5% window here and you miss that, then it triggers a penalty. And what is the penalty is very significant, of course. It's if you don't meet this requirement, it's $2,000 multiplied by the number of full-time employees, and then you can subtract 30 from that. So if you've missed this 5%, then you've got to multiply $2,000 times all your full-time employees minus the 30, and that's your no coverage penalty. Also, when you figure the number of employees that are covered by your plan, that's based on a control group basis, and so that's another thing to think about, is what other members of your control group are also commonly controlled, and so you have to look at that entire group. And so control group is really important for other purposes, for retirement plan purposes. Now it's really important for this purpose too, which is a very significant penalty.
John, what about people that have independent contractors that they might be concerned about, whether they're really independent contractors or employees?
That's an excellent point. And what Brandon's asking about, there's a lot of employers use independent contractors from time to time. There's always been some question in those circumstances as to whether an independent contractor is really an employee. The IRS cares about that, and this has been an issue for years. Now with the player pay, no coverage penalty, it's really, really important to identify who is your employee, because if you are missing that determination and it's not correct, then those people will be counted as your employees, and you could be missing your coverage test. So, the independent contractor determination has become extremely important. It's always been important, but now there's just one more significant cost that could be incurred if you miss that. In the rule, the no coverage penalty is triggered unless you cover full-time employees and their dependents. So that brings into the question, who is a dependent that you have to cover? And we know that the top two circles have been pretty easy to identify. Birth children up to age 26, adopted children up to age 26. Those have always been clearly dependents that have to be covered. Spouses are not required to be covered for purposes of this test. And something has been made clear in the most recent regulations that Brandon and Jim have referenced, that is in the last regulations made clear that stepchildren and foster children are not considered to be dependents for this purpose. And so that is really something that's kind of a change. A couple of years ago, when the age 26 requirement that you had to cover children up to age 26 came out, the IRS said that you could use as a safe harbor the Section 152 definition of dependents and children. And so at that time, a lot of you all, a lot of our clients changed their plans to provide that dependent children include stepchildren, even if they didn't live with the employee. And so at the time, that was considered to be the safe harbor. But what the IRS has said in these final regulations that were issued is that stepchildren and foster children are not considered to be children that have to be required as dependents. And then also, the other circle with an X is, of course, any child that's above age 26 does not have to be covered as a dependent child. There was that's the no coverage penalty. That, as I said before, the coverage penalty can only be triggered when you determine those people. The coverage penalty is only triggered if a full-time employee goes to an insurance exchange, enrolls in the coverage, and qualifies to receive the premium subsidy. So in general, a person is qualified to receive a premium subsidy if their household income is less than 400% of the federal poverty level, which, just to give you a ballpark where that is in 2014, for 2014, the level for an individual is $46,680, and for a family of four, the income level would be $95,400. So, if a person is above that level, they probably won't qualify to get the premium subsidy. So that's not a person that's going to actually trigger this. There's no requirement that the coverage that is provided has to be minimum value that we're going to talk about in a minute. And there's no, as I said before, there's no requirement that you have to offer it to the spouse. One of the questions that's come up, and Jim and I have talked about this, Jim and Brandon and I have talked about it several times, is what are some alternatives? Clients usually ask this, what are some alternatives that an employer can use? Maybe they don't want to, they want to comply with this no coverage standard, but maybe they don't want to provide a plan that's completely has a really significant coverage. Jim, what have you been telling your clients on
Well,
skinny plans?
the one alternative that is out there. I mean, one alternative is to obviously fully comply, provide the kind of plan that you need to provide for your employees to attract and retain them. If that's not feasible, there is an alternative, at least one, and that's what's commonly been referred to as a skinny plan or a bare bones plan. It's a healthcare plan that actually is designed to comply with all of the mandates that are imposed, the requirements under healthcare reform. For example, the requirement that a plan provide 100% of the cost of certain preventive care services. So these skinny plans will provide 100% coverage on the required preventive care services, and they will otherwise comply with the requirements of healthcare reform, but they don't cover very much. They exclude, and I think John mentioned it, a plan satisfies the requirements for this to avoid this no coverage tax if it is an employer-sponsored plan, and it otherwise satisfies the specific requirements that are imposed on plans that we've talked about in the past, like you can't have an annual or a lifetime maximum on benefits. Well, this type of plan, the skinny plan, doesn't have any annual or lifetime limit on the benefits that it provides. It just doesn't provide many benefits. So you may have a plan that doesn't cover heart disease, or it doesn't cover cancer. So those plans are out there, and they're available. It sort of reminds me of the mustache. Quite frankly, they may be a good idea at the time, but be careful, because looking back, they may look like, what is he thinking? It may be something that you want to look very carefully at to make sure that, in fact, that it does comply with all the requirements.
The kinds of clients that I see that are interested in the skinny plans, as they're called, are typically, like, for a good example is I represent a private Christian school, and they've never offered health coverage because their full-time employees view working there as a ministry. And so the cost of providing a huge health plan from scratch is pretty significant dollars. And so a skinny plan, especially for smaller employers, those are really the kinds of folks, and everybody's looking at all their options, but really it's the smaller employers without very much money that they can't afford the impact of a big, robust health plan that are going to be interested in these skinny plans. Okay. I mentioned before there's a transition rule in these final regulations. When I said there was 95%, you got to cover at least 95%. Well, for the special rule for 2015 is that level is lowered to 70%. It's just for 2015. It's important to note, though, that even if you meet the 95% or the 70% standard, and you don't cover 5% after 2015 or 30% in 2015, then you'll still have the potential to get the B penalty that we're going to talk about in a few minutes on those people that you're not covering, those full-time employees. So this gives you a little bit of room, but it's not like something that's going to put you in the clear completely. And it's probably, this lowering from 95% to 70% is good, but it kind of, in our view, it kind of gives you a little bit more wiggle room in the case that you do have some of these independent contractors or employees that you didn't count on, or somebody like that gives you more room for error, so to speak, in your test for the inadequate coverage or the no coverage test. So the second
the second test, the other test to talk about is the inadequate coverage penalty, and that's the flip side. So this is when you have offered coverage to folks, but this is when you have not offered coverage that's affordable or that it has minimum value. And so even if you've satisfied the first test, you've offered coverage, it may not, like in the case of what Jim was talking about, the skinny plan, it may not be affordable or have minimum value. So this is also, in our view, I think it's in some ways less significant, even though the amount of the penalty is $3,000 per person who has inadequate coverage. Again, that person has to go to the exchange and qualify for a premium subsidy in order for this premium to be penalty to be triggered. So it's when you look at that, the amount of the coverage that's affordable is determined on a self-only coverage basis, and it's based on the coverage. The minimum value has to be at least the lowest cost has to be at least 9.5% of the household income. The final regulations have some safe harbors in determining the minimum value and the affordability. And those, if you look in the regulations, they have one test is based on W-2 earnings, the other is based on rate of pay, and then there's a third. This is the easiest, probably, is just based on the federal poverty level. So that's the first element, and then minimum value is based on the percentage of the cost of the medical plan that are covered by the plan, and if that's at least 60%, then you pass that portion. The regulators have come up with they're coming up with a calculator in order to determine whether your plan has minimum value. They're also coming up with a design-based safe harbor that's not out yet. Those are two methods of determining that. And then finally, the other way to do that is to get an actuary to certify that your plan is minimum value. Another point on this, for example, if you have collectively bargained employees and you've agreed to make contributions to, say, a union plan, a multi-employer plan, that the regulations say that will count as coverage. But on the other hand, you've got to take into consideration that union plan, you need to know that plan is affordable and has minimum value in order to know whether you've passed the inadequate coverage penalty test. So that is something to consider if you're doing collective bargaining. I know I've talked to Tony Puckett about this, and he was kind of concerned that in collective bargaining negotiations, that's a representation that probably needs to be gotten from the union so that the employer can protect themselves. Next, just like to talk about the different categories of employees that these, when Jim was talking about the look back period and how we run these calculations of who's full time, there are various categories that the regulations look at. One of which is, of course, the most obvious one is full time employees. When you think about employees, when we're talking about independent contractors, I guess the most important concept is, who's an employee? An employee is a common law employee. You look at factors of whether the employer controls the employee, and that is what the IRS has told us for a long time is what determines whether the employee is considered to be your employee. The employer is on the hook for the penalties for failure to comply with the player pay penalties. So, there are some categories of employees that you ought to think about in terms of the player pay regulations. There are temporary employees. You just want to think about, are they? Some employers don't even think of them as their employees. There's independent contractors we talked about. In the case of multi-employer plans, keep in mind that the employer is still responsible for that. So, if we talk about who are the full-time employees, the regulations are pretty clear. It's anybody who works at least 30 hours a week or 130 hours per month. That 130 hours a month, if this is just a nuance, the standard for that definition in the determination of applicable large employer to see whether you're at least 50 if you have at least 50 employees or not is 120 hours a month. But if an employee is considered to be a full-time employee, you have to offer coverage as of the first day of the 4th month following their date of hire.
And John, people need to keep in mind their waiting period regulation also, because the waiting period rules, which are different than these rules, require coverage to be effective no later than the 90th day after they're eligible, right?
That's exactly right. It's a little bit funny. These different rules sometimes are inconsistent, and so you have to use the lesser of. Another category of employees to consider are variable hour employees. And if they're variable hour employees, then that brings in the whole look-back period analysis. Variable hour employees as anyone that's not reasonably expected to work a full-time schedule of 30 hours a week. The regulations give us some guidance as to what is a reasonable expectation of a person's hours of employment. They tell us that there are some factors to consider. Was this position advertised with a certain number of hours that would tell you whether it's variable or not? The extent to which other employees in the same position work variable hours or not, and whether the employee is replacing somebody who had a number of hours. So if you look at those factors, even though this is intended to be a facts and circumstances test, you can look at those factors to help determine whether an employee is variable hour or not. One way to give yourself a little bit more certainty when you have a variable hour employee, and this, you think about it, like wait staff in a restaurant, people like that. There are a lot of categories like that where you really don't know whether they're going to be working full time or not. But one way to give yourself a little bit more certainty is to try to provide a work description where you actually include that in the work description, so that you're putting in writing. This is what's expected. The number of hours. We don't expect it to go over 30 hours or something like that, and try to lock that in so that it's everybody's understanding, so that you're not trying to put together a rationale after the fact when someone's questioning that. The next category to consider is our seasonal employees, and seasonal employees. The proposed regulations that came out last year, they pretty much permitted employers to use a good faith determination of who is a seasonal employee. Well, that good faith determination is now no longer valid, and the final regulations that came out say that they have a very specific definition, and so a seasonal employee is defined to be someone who is in a position that's he's performing services at a recurring time each year, and their period of service doesn't last more than 6 months. And so the practical effect of that is, and it's important who is a seasonal employee, because if they're a seasonal employee, then you apply the look-back period test, and so you don't have to offer them coverage within 3 months or 90 days of their beginning date. You can do the look-back period and test to see whether they're full-time or not. And chances are a seasonal employee will not be there at the end of the measurement period. So seasonal employees is a really important standard and an important category. the next category is part-time employees. This is something new that the final regulations have added this category. They're treated basically just like a variable hour employee, and so you would treat them just like you would have to measure their hours during the measurement period, treating them just like a variable hour employee. One kind of hybrid category to think about is if you have a short-term employee, and we've gotten these questions from our clients pretty often. A lot of times, a employer will hire somebody maybe on a project basis or something like that, and they really don't want to provide them coverage, and so they're looking for an explanation of why they wouldn't. Well, a short-term employee, unless they're a seasonal employee, are treated as a full-time employee if they're working full-time. And so it's really important to not just focus on the fact that they're short-term, but whether they're actually providing full-time services. Now, there are some situations, I guess, where a short-term employee could be seasonal, and if you can qualify under that prior slide, the standard under the prior slide, then you can qualify them as a seasonal employee. So I think that's, let me see. I think from here, Jim's going to take over.
All right. So, yeah, we're going to talk about hours of service, which is the sort of corollary to what John's been talking about. So just to kind of catch myself up, so we're trying to determine who our full-time employees are, right? We're trying to say, okay, who is it that we have to provide coverage to in all of this, and to identify the ones that we do have to provide coverage to, and then identify conversely the ones that we don't have to provide coverage to, and all of that is that it's going to play into whether we satisfy this 95% rule of coverage and or for 2015 70% rule. Is that so? With all that in mind, then how do we count hours of service? When you have somebody and you're trying to determine whether they work 30 hours a week, how many hours? What are the hours you have to count? Well, first of all, you got to count hours that they work and get paid for, and basically anything that they get paid, any time that they get paid for, including paid time off, sick time. What we don't know, there are a couple of things we don't know, and the government has recognized that they haven't provided us with answers to these, are questions on, for example, someone that's on workers' comp, on short-term or long-term disability. They're getting paid, but they're not getting paid by the employer necessarily. So do those hours have to be counted? And we don't know the answer. There are some of these quasi work relationships that may count in terms of counting the hours that are used in the determination, that we're going to have to come back to you as soon as we hear it. But for the time being, let's count every hour that somebody gets paid for. Now, we have people who don't get paid by the hour. And for those people, we can count the actual hours they work if they count their hours, if there's some way to do that. There are also a day's work equivalency. So if they get paid for a day, or paid any amount on a day, then you count them you give them 8 hours. And then for weeks work, you can give them 40 hours per week. So if they work at any time during the week, you count that as 40 hours. Retirement plans have a similar rule, although, as you might guess, they wouldn't be exactly the same. They're going to be, I think it's a conspiracy to make it as confusing as possible. Retirement plans don't allow you to count, they require 10 hours for a day and 45 hours for a week. So anyhow, there are these equivalencies. So given all of that, you count all those hours, you apply the look back periods, and then we determine whether they are working 30 hours a week or not. Now, new subject is what about staffing firms? What are we doing with staffing firms? And staffing firms being the professional employee organization, the employee leasing companies. The key question here is it's similar to the independent contractor question, and that is, who is actually their employer? And the answer to that question is really a fairly involved analysis into who controls them, who receives the benefits of having them employed, who can profit from having them employed, who provides them with benefits and reports them as employees. So most of the leasing agreements, the staffing agreements that I've seen, are set up to indicate that the employee, that the worker, is employed by both the leasing company and the user company, the on-site employer. I mean, they say they're co-employers. Now, that sort of begs the question: can someone be employed by two different employers at the same time? And I mean, apart from I think there's a biblical requirement: you can't serve two masters at the same time. You know, what is it? You'll despise one and honor the other, or something. But according to the IRS, this is some time back in the 70s, and not for purposes, obviously, of healthcare reform, the IRS found a situation where someone was, in fact, employed by two different entities at the same time, and it involved a department store where employees worked in a jewelry department in a department store, and they were the jewelry department was what was called then a leased department, but they were supervised by people inside that worked for the department store, although they were also supervised by the leasing company's employees. That's not the way the typical leasing arrangement, employee leasing, professional employee organization arrangement works in my mind. In most of those cases, in most of the professional employee organization cases that I know of, and you guys might put you on the spot and ask you if you know of any others, the work site employer is the person who actually controls what the employee does, tells them what to do, like you do an employee. You tell them what to do and when to do it, and how to do it. And if that's the case, then, and you're using those people, if you're a worksite employer, then you're probably the employer, and you're the one that has the responsibility then for complying with the healthcare reform. If, on the other hand, the leasing company really is supervising, in other words, there are no other supervisors, and the leasing company provides not only the workers but the supervisors, then the leasing company may in fact be the common law employer. But that's a determination that you need to make to ensure, if you're using those types of arrangements, that you're in compliance. Another subject that is coming up is the new mandatory reporting. And there's a number of different new reporting requirements, but this is reporting on the shared responsibility and minimum coverage requirements. So there are basically two different pieces of information that need to be reported to the government and to your employees. One is whether you are providing what is considered to be minimum essential coverage. In other words, whether the health plan that you are providing to them satisfies their requirement. Remember, individuals now are now required to have coverage. I think yesterday, or the March 31st was the deadline. I guess last Friday was the deadline. Whenever that was, March 31st. I think he's back. I think that mustache has taken its toll. I mean, there was some. At any rate, individuals have to have coverage, or they pay a penalty tax. Well, you're beginning in 2016. You're required to report to them so that they can show, to provide them with a report so that they can show that they had coverage. And so you report not only to the employees, but also to the IRS. In addition, you got to report to the IRS in terms of whether you are providing the shared responsibility coverage for your employees. So, and you report that also to both the employees and to the IRS. Now, the difference in how that's all done is going to depend in part on whether you have a fully insured plan or a self-insured plan. Because if you have a fully insured plan, then the insurance company is responsible for reporting the minimum essential coverage, the piece that the employee uses to prove up that they've got coverage and that they're not subject to the individual mandate tax. If you are a self-insured employer, then you have both of those responsibilities. Now, the method of reporting, it will be similar to W-2s. In other words, and it's not going to be the W-2 though. It's not going to be able to be put on the same form as the W-2, but it'll be similar where you provide an individual report to each employee, and then you accumulate all of them and send it to the IRS. The forms, which are not available yet, but they provide us with a number, are 1094 and 1095. So that is something that's coming up. As I said, the first reporting will not be required until 2016, but it will apply to 2015, which seems like a long ways away at this point, but it's something that you need to be aware of, to be thinking about, and getting either your payroll company and or your TPA, third-party administrator, to be working on to make sure that you've got that you're accumulating the information beginning in January of 2015, so that when the reporting period comes up in 2016, you'll be ready. The first date that anything will have to be reported is January 31st of 2016, which is when those individual reports have to go out to the employees. So that's new mandatory.
One thing I would say on that, the reporting, just to add to that, we've all spent so much time focusing on the player pay rules, which rightfully so, because it's right here and right now. And Jim's going to cover the Cadillac tax also. To me, the two big things on the horizon employers really need to be zoning in on right now is this reporting issue, because from talking to people, I don't think the reporting mechanisms are in place. I don't know that we're collecting the data that we will need, or even have the systems designed, especially for you large employers, to report that information. So that's something that, as Jim said, that you should be looking at right now, and likewise the Cadillac tax, which we'll talk about in a minute.
Yes, and we are. But before we talk about the Cadillac tax, we mentioned earlier the waiting period. We have some clarification on the waiting period rules. But the basic rule is that a person has to be, if you have a health plan, and a person becomes eligible for the health plan, they have to become covered under the health plan within 90 days of the date that they become eligible. And that's a pretty hard and fast rule, and it's 90 days. It's not 3 months, and it's 90 days. It's not the first payroll period after 90 days, or it's not the first day of the month following 90 days. It's 90 days. The only exception that we have, or that we have to that, is two exceptions. One being that when you're applying these look-back periods, the eligibility period to determine whether someone who's a variable hour employee is truly a full-time employee, when you're applying that and you're looking back and you've made that determination, then you can the 90-day period, you basically have a pass on that, so long as no one has to wait more than 13 months after their date of hire to become actually covered under the plan. The other sort of exception is an orientation period that you're allowed to have, which is a period that it's for determining if somebody is actually eligible for your plan. So an example is you have categories of employees, and an employee is only eligible if, for example, they are licensed or they have completed a 2-week training period. In other words, the person's not eligible for your health plan until that has happened. You can have that period doesn't count for the 90 days, so long as it's not a subterfuge for an additional waiting period. There has to be some substance to it. It can't simply be a pretense to say, and so really what you can't have is that everybody that you hire ultimately becomes qualified, ultimately becomes eligible, and try to say that you got an orientation period. We did want to mention, we don't ever want to do seminars or anything that we don't mention same-sex spouse issues. So we're going to mention that. It's been largely covered. The Supreme Court has said that the federal law that distinguishes between same-sex marriage and heterosexual marriage is unconstitutional. There are a few. There's significant retirement plan issues with that decision. The decision doesn't expressly require that you provide health care coverage to same-sex spouses. There are some risks that you run if you don't, but it doesn't specifically require that. And in fact, the Department of Health and Human Services recently issued a notification, a clarification that said, our rules say that insurance companies can't discriminate based on sexual orientation, so you'd have to provide an insurance policy that is governed by the rules of the Department of Health and Human Services has to provide coverage. But health plans, we're not saying that health plans have to. Now, I think we are thinking that maybe the best practice is to go ahead and do it, but there's not a specific requirement in the law yet to do that. Then there are some health plan issues, though, that you should be aware of, and that is spouses are sometimes spouses, if unless you distinguish between same-sex and non-same-sex spouses, are eligible for different kinds of benefits, such as COBRA notices, HIPAA notices. Under your cafeteria plan, their expenses can be paid for. So if you have that issue, that's something that you should be aware of. Finally, get to the long-awaited Cadillac plan tax. We want to be brief about this because the doomsday clock in the back is going off. This is a tax that's going to go into effect in 2018, and it's a tax on employer-sponsored coverage that is too good. So it's basically if you're providing a benefit, and this includes the benefit that the employee actually pays for, if you're providing a benefit and the aggregate cost is a factor of the formula is we take 10,200. So if the value of what you're providing is 10,200, it's greater than that, then you pay 40% of the amount that it's greater as this excess benefit tax. That $10,000 will be adjusted for the increase in medical costs between 2010 and 2018, but it won't be, if that adjustment is not necessarily based on cost of living or even the cost of of healthcare coverage generally, but the increase in the cost of a the federal Blue Cross Blue Shield policy that is provided to federal employees. So, with that, I think that's the end of our presentation on the Cadillac tax. I don't know if anybody has any questions. I do see that we've got the red light back there, so I think we are officially out of time. But we're happy to hang around and answer anything else that you all might have.